My name is Lacey Burris, and for my student presentation, I am doing Kawasaki's disease. The reason I'm doing Kawasaki's disease is because it is something I was diagnosed with when I was a little baby. I was the first child to be diagnosed with it in Lubbock, as well as the first female to be diagnosed with it in the state of Texas. With this disease being extremely rare and not a lot of people knowing about it, I thought it would be a cool idea to do it for my student presentation. That way y'all could get a little bit more familiar with it. What is Kawasaki's disease and how does it affect the human body? Kawasaki's disease is a rare illness that causes inflammation of blood vessels and is also the leading cause of acquired heart disease among children 5 years of age and younger. It can cause cardiac complications in the coronary arteries. The picture of the kid below, on my next slide, it'll explain it further. But one thing I want y'all to notice is his eyes are extremely red, almost bloodshot, and his cheeks and ears are really red. Those are two of the symptoms of Kawasaki's disease. What major organ system does this disease most directly affect? Kawasaki's disease really doesn't bother any other organs except for mainly the heart. The other organs that it does affect are the skin, mucous membranes, lymph nodes, and the blood vessel walls. How would a healthy body or a healthy heart work in this situation? The functioning, like I said, of most of the organs would be perfectly fine. The organ that it would most directly affect would be the heart. When dealing with a heart fighting Kawasaki's disease, the coronary arteries are most often affected. Part of the coronary wall can be easily weakened, causing a balloon and an aneurysm. This can cause a blood clot, which can sometimes lead to a heart attack. The aneurysm also has the possibility of bursting, but this is really rare. Also, heart problems from affected patients usually go away in about 5 to 6 weeks, and there is no long-lasting damage. One thing they were saying, and I'll get to it a little bit further in the presentation, is that children that are not seen by a doctor and treated for the symptoms of the disease will probably maintain some type of heart defect. Children that are treated whenever they find the symptoms usually have no heart problems at all. This was a pretty cool picture that I found on a children's hospital website. Now, if you see where it says clot and dilated LAD, that shows you where a blood clot was caused because of the stress on the heart from Kawasaki's disease. I just thought it was a cool picture. Put it on here, give y'all an example, and show y'all how stressful Kawasaki's disease can put on a heart. So that's that slide. How is Kawasaki's disease diagnosed? Kawasaki's disease really has no way of being diagnosed. What doctors look for are symptoms. When I was a baby, I had 5 out of 7 symptoms. So it just depends. Usually what they do is they make the cutoff 5. So if you have 4, you probably don't have the disease. If you have 5, then they're going to start treating you for the symptoms. What are the symptoms of Kawasaki's disease? So far, Kawasaki's disease has really 6 main known symptoms. Those symptoms are a fever lasting at least 5 days, red eyes, a body rash, swollen red lips and tongue, swollen red feet and hands, swollen lymph nodes in the neck. And some of the minor symptoms include peeling of the palms and soles, joint pain, irritability, rapid heartbeat, and difficulty of breathing. If you look over to the right, the very first picture has 2 hands, and you can kind of see how they're swollen and bright red. Right underneath is a child that has bright red eyes, just like the second slide that I showed you. This was one of the symptoms I had, were the bright red eyes. This Third slide is the swollen red lips and the tongue. That was another symptom I had, and in fact, mine was so bad they had to put me on a breathing machine because it was so hard for me to breathe. The fourth slide is a picture of feet that have been swollen, and you can kind of see how it's really red around the toes and ankles. And lastly, the very bottom slide is an example of the peeling palms. What causes Kawasaki's disease? What causes Kawasaki's disease is still unknown, but doctors do not find it to be hereditary or contagious. So that's a good thing. So that doesn't mean it can be passed on to children or you will get it from your parents. There is some beliefs that the disease might be caused from bacteria, an infection from a virus, or even a microbial agent. Whenever I was diagnosed with Kawasaki's disease, I believe I was around 2 months old, and it was so rare to see a child, even born with it in the first place. So whenever I was taken to the hospital, they were trying to figure out how I could have gotten it, what could have caused it. And what they have kind of come to believe is 2 weeks before I was born, my mom and dad had the carpets cleaned in our house. And whenever they had the carpets cleaned, all the bacteria was brought up to the surface. And whenever I was brought home, I'd lay on the ground and I would crawl, and they said that I could have possibly inhaled some of that bacteria, and that could have been a way that I had gotten Kawasaki's disease.